Okay, I want to talk to you about a couple of things. Number one, indemnity coverage. Indemnity insurance is what I call a bucket of money insurance. It's just like it sounds. They just hand you the bucket when you need care. And you spend the bucket of money how you need to spend the bucket of money, where you need to spend the bucket of money. Every other type of insurance works this way. Health insurance is the only one that doesn't work this way anymore. It used to, it did forever, but for the last decade or so, we've decided that we want the insurance company to control our care. That's so we buy managed care insurance. It's a PPO or an HMO or a POS or a EPO or some three-letter word that means they get to manage our care. They get to control our doctors and tell them what they can and cannot do because they're the ones writing the check to the doctor. In the old days, the insurance company and the doctor didn't talk to each other. The insurance company just wrote you the check and you dealt with your doctor. You paid your doctor. The doctor worked for you. He did what you wanted him to do, what was best for you and in your best interest. And the insurance company just paid you the check. They just wrote you the check. The best indemnity plans will have, and there's only a few of them. There's literally about two that I think are really the best plans out there. And they have actually already paid the fee for you to be a member of the largest PPO network out there. Now, again, it's still indemnity coverage, so you can go to any doctor you want to, any hospital. They're just going to write you a check. But they will write that check directly to the doctor or to the hospital if you want them to. So if you don't want to get in the middle of this and you don't want to negotiate and you don't want to do all this kind of stuff, you have the ability to just walk in, hand them your card, and the little girl at the front desk will be tickled to death because it has a PPO multi-plan, the largest PPO out there. So almost every doctor and hospital are part of it. And she can just type it in. She doesn't even have to think. She just types it right into her computer and it's automatically filed and discounted. And the insurance company will pay directly to the doctor or hospital. So if it's an emergency, then you're welcome to. Don't even think about negotiating. Just walk in, hand them your card, and be done with it as if you didn't care about the cost. But if it's anything where you can negotiate, where you have the time, where it's not an emergency, if you just ask, you shall receive. They will drop that thing so fast if you just tell them they don't have to file it with an insurance company. I just want to show you a few things. Some techniques that you can also use to get it even cheaper. And I asked Bill what kind of surgery. I texted him after we got off the call, and he said it was an inguinal hernia. So the first thing I did was use old Dr. Google and went on Dr. Google's website and put in their inguinal hernia surgery cost. And just like Bill said, it says in the average hospital bill for routine hernia operation is $5,800, and that doesn't include the doctor's bill. So the surgeon, it doesn't include this. That's just the hospital. Many of our patients have told us that the cost at their local hospital can be over $10,000. So Bill got it for $5,800. So he got over 40% off of his bill, which is great. And it was his regular doctor, his surgeon, that told him he needed to have the surgery. The only person he ever talked to about this, he just said, "How much would your cash price be?" And this guy dropped the price right there on the spot. And he even negotiated the price for the whole package, the surgical center, the anesthesia, the whole 9 yards, and cut it down to the total was $5,800, as Bill said. The insurance company, Philadelphia American in this instance, just wrote Bill a check for $6,700. Bill got to spend the money how he wanted to spend it. First one was this affordable surgery, affordable hernia surgery. I went to that website. Now, they're in Rockville, Maryland, but look at this price. It's $2,100 flat rate, and it includes everything. And their whole pitch is that's all they do is hernias. Because our hernia center does so many surgeries, the care we provide is better than your traditional surgery options. As with most operations, if your surgical team is more experienced, they get better results than when the surgeon and his team do not do as many cases. But don't take our word for it. See our patients report on Facebook and the testimonial page. They say they have quicker recoveries, smaller incisions, and less pain. And of course, they get better value that is the best in the country. But they're in Rockville, Maryland. He's in Concord, North Carolina. So just on a whim, I said, okay, what would first class tickets from Charlotte to Rockville, Maryland cost? And it would be $324 one way. So he'd need two of those. So it'd cost him about $750 for first class tickets to Rockville, Maryland. So now he's not going to be able to just have the surgeon come right home. He's going to need to probably stay overnight and then go back to see the doctor again the next day to check on him to make sure everything's okay before he can head out. So I looked up what would the hotels close to that address in Rockville, Maryland. There's a Bethesda Marriott that's $279. So for $750 for the flight, first class, by the way, and then staying in a Marriott hotel, he's looking at about $1,000. And again, this was only $2,100. So with the flight and the first class tickets and the Marriott hotel, he's still less than $3,100, around $3,100, versus he paid $5,800 to go to his local doctor right here, which he still got a great deal. But I just want to show you, if you just use Dr. Google, sometimes it's even less. And by the way, the next one down, I didn't show you that on the thing, but the next Dr. Google's website had said was Surgery Center of Oklahoma, and for an inguinal hernia, it was only $3,060. Now again, he's still going to have to go to Oklahoma to have this done. So, but here's a place and this one didn't come up on Google's search, but I just know about this, and so one of the things that I'll help you guys know is this is a thing called the Free Market Medical Association. This is a group of doctors and surgeons and all kind of medical providers that have put their services on this website with no insurance. You can't use insurance. You have to pay it yourself, and you file the insurance yourself if you want to, or whatever. Okay. But anyway, I put in hernia in here, and the first one that came up was inguinal hernia surgery for $2,500 in Winston-Salem, North Carolina. This is 30 to 45 minutes up the road from where Bill lives. I mean, this is just really literally 30, 45. He doesn't even have to stay overnight or buy airfare. For $2,500, he could have gone to Winston-Salem, North Carolina, and had it done. Here's another one, and these are just techniques and tips that you can use. You don't have to do any of this. I'm telling you, you can just ask your personal doctor what's their cash price. They will drop it right, give you a nosebleed dropping that price so quick if they don't have to file the insurance. But if you go to metabid.com, this is kind of like the eBay of healthcare. You put what you're looking for in there, and doctors and surgical centers and medical providers around the country will bid on your treatment. They will actually fight each other over trying to win for you to come to them. So, and here's another one. The last one that I want to talk about is Healthcare Blue Book, and it's at healthcarebluebook.com. And this is kind of like the Kelly Blue Book of healthcare. It tells you $9,100 is red. It's not very good price. That's very high. It tells you $2,600 is a really low price, but they tell you that a fair price is $39.77. So if you can get around there, that's a really good price. And then what they do is they break that fair price down into what the facility should charge you, what the surgeon should charge you, and what the anesthesiologist should charge you. So you've got an idea before you even start negotiating where you want to be if you go to healthcarebluebook.com. So again, indemnity coverage is like a bucket of money. It's like every other insurance that we buy. When you wreck your car insurance company will write you a check. And you spend the money how you want to. The auto body shop works for you. And if you need a new roof on your house, the guy comes out from the insurance company, he looks at your roof, he writes you a check. You hire the roofer that you want to hire. There's no networks. The insurance company doesn't tell him how he can work on your house or anything. You pay the auto body shop. You pay the roofer. The insurance company just pays you, and you get to keep the extra money if you cut a better deal. If you want to spend more than the money's that's in the bucket from the insurance company, that's your prerogative. But at least you know where you stand. Anyway, I just wanted to give you that information. Bill did a great job, and you can too. That's what's so great that I want everybody to understand is that insurance is not necessary. If you've got the money, you can just write the check. You don't even need health insurance. You could do it if you just put the money away and had it. You really only need it for your catastrophic stuff. Now, you do need it for catastrophic stuff. And there's even critical illness policies that you could buy, accident policies that you could buy that are real cheap and really save you a lot of money if you're only wanting to cover the catastrophic stuff. There's even life insurance that you can buy that has critical illness coverage already built in, and it has long-term care type of insurance already built in. And I mean, there's so many ways to skin this cat besides Obamacare. Okay? So I just want you to know that. God bless you. Have a great day. Talk to you later. Bye.